The most important feature of having joint vibration analysis for me is the diagnostic ability. Certainly there are benefits, financial benefits of having diagnostic equipment that are billable, but for me, I really look at whether or not this has diagnostic value for me. Many times I'm afraid that dentistry has become involved in cookbook treatment because diagnostics have not been completed. For me personally, I think that arriving at a complete diagnosis not only allows me to arrive at a treatment plan that is specific to the individual, but I can also arrive at a prognosis which allows both the patient and myself to set realistic expectations of the treatment.
The first thing you have to realize is that if you're going to treat patients properly, you have to be concerned with diagnosis. And the JVA equipment allows you to determine the health of the temporomandibular joint. BioResearch have certification programs to train your staff on the use of this equipment, and most of the taking of the data is done by the staff, and the interpretation of the data is done by myself. But it's an essential part of my practice.
It's critical. The JVA is the only device in existence that evaluates a joint function. MRI is a static picture. Tomogram is a static picture. A SIN tomogram or SIN MRI are just static pictures that are strung together to make it look like it's moving. But the reality is that they do not evaluate it while it's moving, and that's what you need it for.
I got into doing the JVA out at PAC Live. Dr. Steve Rose introduced us to that, and it's been a huge adjunct to helping to explain and educate dentists about what's going on with the jaw joint as we're doing these major restorative cases, and often just the aesthetic cases that come through have underlying problems that may be lying dormant, and we need to know what's going on before we go in to do a lot of restorative dentistry.
When I've used it, it has made perfect sense. It's very easy to incorporate. It's quick. One of my staff members actually can take the tracing, and then I get to do the analysis of it.
It's extremely important when you're dealing with these kinds of problems that you document, that you have a recorded way of going about evaluating their injuries. So with the JVA and the JT, with the jaw tracking, you know exactly what point the pathology is taking place. And it gives you a way to evaluate it after treatment to know whether or not you've corrected these things. The people that don't use these kinds of modalities are simply guessing, and there's too much at stake to guess.
I've brought my staff to all of this stuff. My entire team knows how to use it. For me to actually put it on the patient and use it, I don't know how. My staff does a fantastic job at it, but I know what it's doing, and I can look at the information.
Great.
And so, actually, it takes no time for the doctor.
Personally, I use the JVA as a screening tool. The jaw tracking I use before I do any records, and I can't imagine not doing it.
From a medical legal record standpoint, I think that the JVA has been invaluable in creating a documentation for our diagnosis and for our examination that previously we would have just relied on impressions and notes and very subjective analysis. Now we have a much more objective analysis that we can use to sort out these cases before we start. It's also interesting that after we're through with our cases, the patients want to know, how is it? How is my jaw? Is it better? Is it worse? Is it the same?
I come in for 5 minutes, interpret it, and then away we go. So it's very user-friendly.
I'm very excited to apply the principles that Dr. Stevens taught us. It's an exciting time.